Delavan man is being billed nearly $700 after getting a skin tag removed from his scalp.
Yeah, but in this call for action case, the price is not the problem for the consumer. He told the I-Team's Kristen Byrne how he is being billed is not fair.
It lasted probably 5 minutes.
Patrick Austin says he was in and out of this Aurora Lake Geneva clinic fast.
So it was really quick, really simple.
He had a doctor's visit in March to remove a skin tag from his scalp.
Sprayed some sort of thing on there to freeze it off, basically. So total bill was roughly around $700.
He showed us his bill, $691 to be exact. And since Austin has health insurance with a high deductible, he's figured out he can save on medical costs by not using it.
Typically, because I know that, there's a big discount if you pay cash. That's why I chose it.
On page 2 of his Aurora bill, he saw this sentence. Patients who do not have health insurance will receive a 45% discount on medically necessary services. And even though Austin has insurance, to cut back on the costs, he paid in cash, $380.
Have you had success paying with cash for other medical procedures or things like that before?
Not necessarily through them, but in other, when I was with a different provider and whatnot, I have paid cash and get a discount with it. So that's why I chose the plan I did.
He thought this case would be the same. It wasn't.
About a month later, I get another invoice from them because they had ran it through my insurance company.
His insurance covered $18, meaning Patrick Austin still owes Aurora nearly $300. The provider had his insurance on file from a different visit.
If they have my credit card information on file, are they going to run that too just because they have it? I mean, that's not right.
And so your main gripe is you wanted to pay with cash and the provider billed your insurance.
Correct. This is my understanding, and there's no state law that says that I have to run it through my insurance company.
There isn't. We checked with the Office of the Commissioner of Insurance. We reached out to Aurora asking for an on-camera interview. Instead, a spokesperson sent us the following statement saying, quote, "We are available to help our patients navigate the medical billing process, which we understand can be complex. We strive to achieve a satisfactory outcome for our patients whenever possible. Patient privacy laws prevent us from commenting further." So the I-Team took Austin's case to Healthcare Blue Book, a web service dedicated to price transparency in the medical field. We wanted to know, was Patrick Austin in the right?
Is it an option for everyone to pay with cash for a medical service, even if they have health insurance?
Sure, absolutely. Patients should always ask about a cash pay price for services.
But there's a catch, according to co-founder Bill Campine.
Many times, providers like a hospital system or an ambulatory surgery center or a group of providers may have a contractual agreement with the carrier.
Meaning that provider is required to run your health insurance if you have it. The I-Team asked Aurora twice in emails if it has a contract like this with a carrier. A spokesperson responded with, all she could offer was the previous statement. Patrick Austin plans to fight his bill.
And looking back, would you do anything differently?
No. I think this is a major issue for a lot of people, and I don't think it's right. And I think, that the healthcare providers and insurance companies need to step up and start doing something about it.
All right, if you just watch this story and you're thinking to yourself, I have no clue if my provider has a contract with my health insurance company, what do you need to know?
And a lot of people might not know that. So if you're wondering that, Bill Campine, you just heard from him with Healthcare Blue Book. He says that patients need to ask that very question. And you can say this, is there any kind of agreement that would prevent you from honoring a cash price? And if they say, yes, Steve, you have that choice of taking your business for your medical service somewhere else.
Shop around.
Absolutely.
So we posted on this on the Facebook
We did.
Not too long ago. What are we seeing from people?
Just hours ago, dozens of people commenting about their medical billing issues. We want to hear from them. So anyone, if they have a medical billing issue, it hasn't been resolved, you can email me at kristen.byrne@tmj4.com.
I'm sure you'll hear from people.
Absolutely.
Kristen.